is Wip Lamba. I'm a psychiatrist who mainly works with people who use drugs.
And I'm Jean-Paul Michael. I am a addiction case manager that works for an inner city hospital in Toronto.
And I wanted to show two books that were co-written by Robert Myers. These are books that are designed for the therapist.
Okay.
And it'll be pretty. So this book is called A Community Reinforcement Approach to Addiction Treatment. It's edited by Robert Myers, who developed the Community Reinforcement Approach and the Family Training version, and by William Miller, who is one of the co-creators of motivational interviewing. We had a session on a CRA, the Community Reinforcement Approach, and we talked about some of the headings. I think I'd like to have a separate session where we show the handouts and go through them together.
Yes.
We could do ourselves or do an imaginary patient, whichever one. And the things that we would go through are the functional analysis of the unhealthy behavior, the functional analysis of the healthy behavior. We would go through the happiness scale and the goals of counseling. And if it has a thing here, we might do a sobriety sampling and drinking and drug refusal for it. It's more of a data book, but it covers the basic steps as well. It also has some of the couples therapy, so maybe we could go through those handouts, see if there's things we can apply to our own relationships with our own partners in our non-Captain Hooked life.
Sure. A quick question about a functional analysis. So a mentor of mine and a good friend of yours, Alex Cottarella, I listened to a presentation that he did, and he was speaking about functional analysis. He says that's one of the first things that he does with a patient. So I was curious as to, like, from a practice perspective, is that something that is typically done in a family practice or not so much? I would think. I don't know if I was pleasantly surprised, but I was just sort of surprised that him saying that, because I couldn't think.
Well, we have to remember the context that Alex works in. Alex works as an addiction doc primarily. And so you'll see people in a rapid access clinic. You'll see people for the drug use, all that kind of stuff. And there's a couple of variations to the functional analysis. One could be, what do you like about the drugs? Mm-hmm. What do they do for you? And I really like it because I know what I'm up against, and it changes completely what I prescribe.
Okay. So is this something we're recommending for every day? Is this something that can be covered in a quick kind of, half an hour visit with a patient or 15-minute visit with a patient? Probably not. Is that? It
depends what your goal for the visit is. If the goal is around drug use, you could cover some elements of it, like get some hooks in your mind around stuff to ask about later. I probably wouldn't do the whole thing, but I would ask, what does the drug do for you? What do you like about it? When do you use it? And then depending on how that conversation goes.
So it's kind of like the Cadillac of assessments in a way, right? As far as
it's the meat of the dinner.
Okay.
If that makes sense.
Yeah.
It's like the main entree of the portion.
Okay.
And this is another book. It's called The Craft Intervention Program, Motivating Substance Abusers to Enter Treatment, Working with Family Members. It's written by Robert Myers and also Jane Ellen Smith. I don't know.
So is this like an addendum to Craft, the book we covered in an earlier session? This is
the book for Craft. So this book for the therapist.
Oh, okay.
So the book that we covered before was for the general public. It's for me. It's for you. It's for our mums. It's for our dads. It's for our brothers.
And this is the therapist guide to Craft.
Yeah, it's
written by the people that wrote it.
Yeah, and they cover all the basics, but in more depth, and they use maybe a bit more jargon, but more like therapist kind of language. It has very similar chapters, right? So it talks about what the therapy is, how to build up motivation in the other. So it almost teaches the family member how to do motivational interviewing. It covers domestic violence precautions, how to communicate with others, reinforcing positive behaviors, how to use negative consequences appropriately, and how to help the loved one improve their life. And the last chapter is how to get the person into treatment.
Okay. So this is a book for anybody that's working with addiction patients in their practice, whatever that
or with family members, or with family members.
Or with family members.
Yeah.
So you're
people use drugs.
But it's more for the professional than the family member themselves.
Yes.
Okay.
Although it's not like it's like top secret. It's not like you have to have like a master's degree to buy that book from Amazon.
Okay. And okay, good. All right.
Yeah, and so I just wanted to share these two books because, I mean, one of them is a bit overpriced, but I think it just has to do with the publisher and stuff. Because a lot of times a therapist, they want to know, what do I read? What do I do so I can apply it with a patient? Sure, these ideas are fantastic, but what do I do in my day-to-day clinical encounters? And these are the books that are for that. And the reason I felt it was important to share it is that unlike some of these other therapies like cognitive behavior therapy or dialectical behavior therapy or mindfulness that have thousands and thousands of textbooks out there in different versions, this one only has a couple or a few.
Okay.
And I think it's a very important tool that can really complement the stuff you're already doing with patients and clients.
Good. Okay. All right. Well, that's interesting. Anything else you want to say about them?
No, I think that's it. And I hope that we could have a session where we go through the happiness scale together.
Sure.
And a functional analysis of unhealthy and then healthy behavior.
Yeah.
Just like a little demonstration. Yeah.
Yeah. The happiness scale. So I that's such a useful tool. In so many groups that I've been involved in past years, it's been something that resonated with people. It's a pretty simple process. And maybe can we post a link to one?
Yeah. We can post a link to one. It might be already on the other one as well. But I wouldn't mind doing it in a way where, like, I'm tired of just giving advice. So we can give you those happiness scales and you coach me through going through that exercise. I think that'll be fun.
Okay. All right. We'll do that at another time. Okay.
All right.
All right. Thanks.
Thank you.
Okay. Bye.
Clap, finish.